So I asked people what they would look for in a therapist should they seek therapy, and let's hear what they said.
The first thing for me in a therapist is that they're a good listener, and they don't interrupt your flow when you're speaking. And after you've kind of paused and stopped, or you've stopped what you said, there's always, in therapy, I think a good question to be asked to prompt further discussion about what you're talking about, what you need help with.
I would want someone who's a good listener and approachable and accessible.
I think I would look for somebody that would be able to understand me and give me balance and direct me to where I should focus. Also, either through professional experience or through actual a therapist that actually has, how would I say, through personal experience. I guess that's important too, with all their knowledge.
Like somebody who will have rapport with me. If it's a man, who would not be judgmental, and would be a good listener. And if it's a woman, I would say attractive, intelligent, and again, not judgmental, and also a good listener, and would be able to give me advice and go through the issues that I have. I think you need to have chemistry with the person that's giving you therapy. And he was a nice guy. He was a divorcee like me, and sometimes we would talk about him, about his life, rather than myself. So I guess that's one way of having a rapport. And actually, we became friends in a way. I mean, it made me very comfortable going to him.
So I guess I picked the female just because I like females better in certain things. Sharing. I feel like females pay attention. I don't know, because right now, sometimes no. I get along with males too. I don't know. That's a good question. At the time, I made the decision, but I don't know how to explain why I did it. Maybe because I want someone sensitive, and I feel like men, if they really tough and stuff, and I feel like women might not be as much. So I need someone to be understanding, that relates to my situation, which is really important to me, and that feels like, okay, I've been through that, so I can help you. Or even though I haven't been, I know how to help you, because I need guidance mostly. So it's like, okay, what is the map? I need a map. I know what I'm doing wrong, but I don't know how to fix it. So I need someone that understands that.
When I fell in treatment, I looked for a male therapist because I thought that I would be more comfortable talking about some kind of topics with a man. Now I'm not very sure about that, but this the first thing that I thought. And the other thing, I looked for someone had helped some people that I know, like my friend. And other thing is, for me, very important is when the therapist has holistic perspective about the human being, figure out how the human being really is in panoramic view, not just a specialist who looking to a little virus by a microscope. I like when the therapist has a
Directive
assertive approach.
Yes.
You know, I like it when the therapist gives me advices and doesn't worry about if it will hurt me or like that. I like when the even when the therapist is seems like a rude, but I like it when he's honest, totally honest. I don't like when the therapist goes around and beating the bush.
The bush, okay.
You know?
Is one, empathy, someone I could easily talk to without inhibitions. I can freely talk to her or him without without fear of being judged. I want the therapist to be who pays attention without looking at the time, not just prescribing medication right away. Really look into the patient or me, my history, my past, and what she wants me to achieve.
Someone who expresses themselves well, someone who is honest and blunt, but not necessarily harsh, someone who is warm and empathetic and definitely not judgmental, and someone who is able to read between the lines and is sensitive to what's going on below the surface, because I have a feeling I would be hard to read.
So let me just walk through again what has been gathered. Essentially, they want a therapist who listens, who knows when to step back and be passive, but at the same time knows when to be more active and directive, giving them homework, telling them what to do, someone who can help them go forward. They want someone who come highly recommended and is respected by their peers and talents. Someone who can empathize with them, make them feel heard, validated, not criticized or judged. Someone who can relate with their experience. Or if not relate with their experience, someone who knows how to deal with that kind of experience that they're going through. Someone who knows how to help them. They want someone who they trust and have a good therapist-patient relationship with, have established rapport with, who they can collaborate with or work with. Someone who would make them feel that they're on their side, that they're on their team. Someone who is unafraid to confront even if it hurts. Someone who can be authentic with them. Someone who is qualified. Someone who has the know-how. They also want someone who is a good fit, like someone they have a good chemistry with. Interestingly, attractiveness was mentioned as one of the traits. Perhaps this could mean that this person is someone who they're interested in, which actually leads them to think that, oh yes, I can be friends with this person because there's a sudden affinity to this person. what was also mentioned was about the time, looking at the time. It makes someone feel, distracted, or someone feel unimportant, or that they're not that they're less interested in what they're saying, that there's more important things that they're thinking of and not paying attention to the patient. Also, prescribing drugs instead of looking at the person at a holistic point of view, or a panoramic point of view, and someone who doesn't treat them like a specimen or a subject, or or a patient, someone to be treated. Also, being friends with a therapist, I think that was also mentioned. The importance of establishing rapport with the therapist, and that kind of relationship becomes strengthened as probably the sessions go along. That tells about the kind of trust that was established there. What in the readings meshed with or resonated with my experiences or my beliefs? I think it's extremely important to create that alliance with the patient, which is what a large portion of what the reading was about. I think alliance is key, and you don't create that alliance the same way with every patient. I think it's very important to establish rapport and establish trust before going to the techniques and the skills and whatever else, because without that you can't go forward. And I think that's very essential at least in the outset of the relationship. Another one that resonated with me was the way of being of the therapist in the session. I think what the writer is saying is that it's more of like an attitude or a philosophy or a way of being, instead of a way of being with the person in the session, with a child in the session, for instance, instead of doing for or something to that person. I think how the individual feels in therapy with you is what makes it therapeutic, or what makes a significant change in their behavior.